Brooklyn Independent Television.
Welcome to HealthBeat Brooklyn on Brooklyn Independent Television. I'm Dr. Monica Sweeney. We go to experts for our health care, but before we consult a nurse or a doctor, we usually express our concerns to family, friends, or neighbors. If those people happen to have some basic health training, even better. That's the idea behind a program we've been following, Healthy Families, based at Long Island College Hospital. But this visit takes us to Bed-Stuy, where a group of non-professionals are learning how to save a life.
What we're going to do is we're going to do a quick power recap of what we came here to learn, which was CPR. All right. Again, this is a life-saving tool. The more people that know about it, the greater it is, especially for the community. All right.
Today we're in Bedford, Stuyvesant, and we are training a group of advocates from various faith-based institutions and faith-based organizations.
Hit the person. Hit them hard. Sir, ma'am, Jack, Jill. Just make sure you see if there's any signs of life. Person does not respond. We're going to airway. Look, listen, feel. So we're going to go ahead and do that head tilt chin lift. So you're going to put that palm on top of the head. You're going to right below the jaw, 2 fingers. Tilt the head. Remember that opens up your airway, straight line.
Today what you're seeing is their 4th day of training, and today's training consists of first aid and CPR training, which is conducted by 2 emergency medical technicians and 1 paramedic from Long Island College Hospital.
If the chest doesn't rise after 2 breaths, don't waste your time breathing constantly. Just give the 2. Like I said, you want to see that chest rise. If it doesn't, that's not the important fact.
The training for the health advocates is 5 days. It's 7 hours a day. We spend a lot of time on communication skills, counseling skills, interpersonal skills, as well as disease content area where they're learning signs and symptoms of HIV, heart disease, cancer, asthma. And then we move into CPR and first aid, which again is what you're seeing today.
Joe.
Right. Now you notice he's not moving, not stirring. So what are we going to do now?
So I'm going to lift.
Exactly. So come sideways. You're going to put this hand right there, flat. Make a little flat palm. Okay? And your 2 fingers, you're going to go into this and just tilt it back. Perfect, just like that.
Okay.
Exactly.
What's great about this group is that they are diverse in ethnicity, but also they're diverse in gender.
Good, a little harder, okay?
When we recruit for everybody, but typically who answers the call frequently are women. I'm happy to say that in this particular group we have 4 males that answered the call.
You want to try to be mid-sternum, in the middle of the sternum, between the 2 nipples.
I heard about the advocate program through my pastor, Reverend Clive Neal of Bedford Central, Presbyterian. And he asked me if I would be interested in being a part of the program.
Start the compressions. I gave the last 2 breaths. When he gets to 30, you get your 2 breaths. Hold on. I come in now and I bring the defibrillator.
The training that I've had so far has been very informative. There's a lot of stuff that I didn't know, and that's going to really help me to help others in our community.
That our patient has been successfully resuscitated, and that's what our goal is.
We need to make sure our men are getting to the doctor. They don't. I like to say that men don't die from disease, they die from denial. And so we have a group of men here who are leading the charge to get men to the doctor.
You're going to come in with the machine. Wait till they start.
The training far exceeded my expectation. We thought we were coming just to learn how to, care for the elderly and go with them with transportation to see the doctors. But actually, it has taught us about looking at the whole person, being respectful, being mindful. I feel very qualified as of today, which is different than when I first came in. But actually, after this training, now I'm confident that I can provide the patients with the things that I was taught here.
Well, congratulations, everybody. I'll see you all on Tuesday.
Brooklyn Independent Television. on the BCAT TV network.